Anxiety. Introduction. Anxiety is a feeling of unease, such as worry or fear, that can be mild or severe. Everyone has feelings of anxiety at some point in their life. For example, you may feel worried and anxious about sitting an exam or having a medical test or job interview. During times like these, feeling anxious can be perfectly normal. However, some people find it hard to control their worries. Their feelings of anxiety are more constant and can often affect their daily life. Anxiety is the main symptom of several conditions, including panic disorder, phobias, post-traumatic stress disorder and social anxiety disorder, social phobia. However, the information in this section is about a specific condition called generalized anxiety disorder, GAD. Generalized anxiety disorder, GAD. GAD is a long-term condition that causes you to feel anxious about a wide range of situations and issues, rather than one specific event. People with GAD feel anxious most days and often struggle to remember the last time they felt relaxed. GAD can cause both psychological, mental, and physical symptoms. These vary from person to person, but can include feeling restless or worried and having trouble concentrating or sleeping. When to see your GP. Although feelings of anxiety at certain times are completely normal, you should see your GP if anxiety is affecting your daily life or is causing you distress. Your GP will ask you about your symptoms and your worries, fears, and emotions to try to find out if you could have GAD. What causes GAD? The exact cause of GAD is not fully understood, although it's likely that a combination of several factors plays a role. Research has suggested these may include overactivity in areas of the brain involved in emotions and behavior, an imbalance of the brain chemicals serotonin and noradrenaline, which are involved in the control and regulation of mood. The genes you inherit from your parents, you're estimated to be 5 times more likely to develop GAD if you have a close relative with the condition. Having a history of stressful or traumatic experiences, such as domestic violence, child abuse, or bullying. Having a painful long-term health condition, such as arthritis. Having a history of drug or alcohol misuse. However, many people develop GAD for no apparent reason. Who is affected? GAD is a common condition estimated to affect about 1 in every 25 people in the UK. Slightly more women are affected than men, and the condition is more common in people between the ages of 35 and 55. How GAD is treated. GAD can have a significant effect on your daily life, but several different treatments are available that can help ease your symptoms. These include psychological therapy such as cognitive behavioral therapy, CBT. Medication, such as a type of antidepressant called selective serotonin reuptake inhibitors, SSRIs. There are also many things you can do yourself to help reduce your anxiety, such as going on a self-help course, exercising regularly, stopping smoking and cutting down on the amount of alcohol and caffeine you drink. With treatment, many people are able to control their levels of anxiety. However, some treatments may need to be continued for a long time and there may be periods where your symptoms worsen. Symptoms. Generalized anxiety disorder, GAD, can affect you both physically and mentally. How severe the symptoms are varies from person to person. Some people have only 1 or 2 symptoms, while others have many more. You should see your GP if anxiety is affecting your daily life or is causing you distress. Psychological symptoms of GAD. GAD can cause a change in your behavior and the way you think and feel about things, resulting in symptoms such as restlessness, a sense of dread, feeling constantly on edge, difficulty concentrating, irritability. Your symptoms may cause you to withdraw from social contact, seeing your family and friends, to avoid feelings of worry and dread. You may also find going to work difficult and stressful and may take time off sick. These actions can make you worry even more about yourself and increase your lack of self-esteem. Physical symptoms of GAD. GAD can also have a number of physical symptoms, including dizziness, tiredness, a noticeably strong, fast or irregular heartbeat, palpitations, muscle aches and tension, trembling or shaking, dry mouth, excessive sweating, shortness of breath, stomach ache, feeling sick, headache, pins and needles, Difficulty falling or staying asleep, insomnia. Anxiety triggers. If you are anxious as a result of a specific phobia or because of panic disorder, you will usually know what the cause is. For example, if you have claustrophobia, a fear of enclosed spaces, you know that being confined in a small space will trigger your anxiety. However, if you have GAD, it may not always be clear what you are feeling anxious about. Not knowing what triggers your anxiety can intensify it, and you may start to worry that there will be no solution. Diagnosis. See your GP if anxiety is affecting your daily life or is causing you distress. Generalized anxiety disorder, GAD, can be difficult to diagnose. In some cases, it can also be difficult to distinguish from other mental health conditions, such as depression. Talking to your GP about anxiety. Your GP may ask you questions about your worries, fears, and emotions. They may also ask about your personal life. Tell your GP about all your symptoms, physical and psychological, and explain how long you have had them for. You may find it difficult to talk about your feelings, emotions, and personal life. However, it is important that your GP understands your symptoms and circumstances so that the correct diagnosis can be made. You are most likely to be diagnosed with GAD if you have had the symptoms for 6 months or more. Finding it difficult to manage your feelings of anxiety is also an indication that you may have the condition. To help with the diagnosis, your GP may carry out a physical examination or blood tests to rule out other conditions that may be causing your symptoms, such as anemia, a deficiency in iron or vitamin B12 and folate, or an overactive thyroid gland, hyperthyroidism. Do you have GAD? You may have generalized anxiety disorder if your worrying significantly affects your daily life, including your job and social life. Your worries are extremely stressful and upsetting. You worry about all sorts of things and have a tendency to think the worst. Your worrying is uncontrollable. You have felt worried nearly every day for at least 6 months. Treatment. Generalized anxiety disorder, GAD, is a long-term condition, but a number of different treatments can help. Before you begin any form of treatment, your GP should discuss all your treatment options with you. They should outline the pros and cons of each and make sure you are aware of any possible risks or side effects. With your GP, you can make a decision on the treatment most suited to you, taking into account your personal preferences and circumstances. If you have other problems alongside GAD, such as depression and drug or alcohol misuse, these may need to be treated before having treatment specifically for GAD. Initial treatment. At first, your GP may suggest trying an individual self-help course for a month or 2 to see if it can help you learn to cope with your anxiety. This will usually involve working from a book or computer program on your own. You will be given advice about how to use the book or program before you start, with only occasional contact with your doctor. Alternatively, you may prefer to go on a group course where you and a few other people with similar problems meet with a therapist every week to learn ways to tackle your anxiety. Read more about these treatments. If these initial treatments do not help, you will usually be offered either a more intensive psychological treatment or medication. These are described below. Psychological treatment. If you have been diagnosed with GAD, you will usually be advised to try psychological treatment before you are prescribed medication. Cognitive behavioral therapy. Cognitive behavioral therapy, CBT, is one of the most effective treatments for GAD. Studies of different treatments for GAD have found that the benefits of CBT may last longer than those of medication, but no single treatment is best for everyone. CBT helps you to understand how your problems, thoughts, feelings, and behavior affect each other. It can also help you to question your negative and anxious thoughts, and do things you would usually avoid because they make you anxious. CBT will usually involve meeting with a specially trained and accredited therapist for a 1-hour session every week for 3 to 4 months. Your therapist should carry out CBT in a standardized way according to a treatment manual, and they should receive regular supervision to support them in providing the most effective treatments. Applied relaxation. Applied relaxation is an alternative type of psychological treatment that can be as effective as CBT in treating GAD. Applied relaxation focuses on relaxing your muscles in a particular way during situations that usually cause anxiety. The technique needs to be taught by a trained therapist, but generally involves learning how to relax your muscles. Learning how to relax your muscles quickly and in response to a trigger, such as the word relax. Practicing relaxing your muscles in situations that make you anxious.